You open the envelope, pull out the invoice, and stop. You have a Medicare card, but you're still staring at a gap fee for a GP visit, a specialist bill, an ambulance charge, or a surprise private hospital cost. It is easy to assume that access to the Australian public health system automatically guarantees zero cost. But making that assumption frequently leaves patients with unexpected financial liabilities. To figure out what you will actually pay, we have to look at this comparison matrix. It maps the health system into 3 distinct tiers: services that are fully covered, services that are partly covered, and services that are entirely excluded. Watch how these populate. Public hospital emergency visits go into the fully covered column. A standard visit to a private GP lands in the partly covered column. And specific specialty services, like most dental work, drop straight into the excluded column. Effectively navigating the Australian healthcare system requires you to actively identify which of these 3 categories applies before you seek treatment. Private healthcare providers are businesses. They are free to set their own fees, and those fees frequently exceed the fixed benefit amounts listed on the government's Medicare benefits schedule. This graphic breaks down the financial anatomy of a standard medical appointment. At the top is the provider fee, say $120. In the middle is the Medicare benefit, which might be $70. That $50 difference at the bottom is your gap. That is the out-of-pocket cost you have to pay. There is an alternative called bulk billing. This is a choice made by the provider, where the clinic accepts the Medicare benefit as full payment, leaving you with zero out-of-pocket costs. To be bulk billed, you must assign your Medicare benefit directly to the provider. As of July 2026, you can give this consent digitally, on paper, or verbally in specific circumstances. But remember, finding a clinic that offers bulk billing is not guaranteed. When you need a specialist, the rules tighten. Securing the standard referred specialist Medicare rebate strictly requires you to have a valid referral before your appointment. A GP referral to a specialist generally lasts 12 months, while a specialist-to-specialist referral usually expires after 3 months. And holding a valid referral does not guarantee that the specialist will bulk bill you. For everyday outpatient care, Medicare covered does not mean free. The trade-off of our mixed public-private system is that you bear the responsibility of checking those fees up front. The financial rules shift during high-stakes medical emergencies. If you receive eligible treatment as a public patient in a public hospital, you generally incur no charge. This branching decision tree shows the contrast. The top path, a public patient in a public hospital, generally equals $0. Take the bottom path. Choosing to be a private patient, whether in a public or private hospital, introduces multiple out-of-pocket costs. You can be hit with hospital excesses, surgeon gaps, and prosthesis fees, even with partial Medicare subsidies. But even when a public emergency department visit is entirely free, the ambulance journey you took to arrive there is explicitly not covered by Medicare. This stylized map highlights why. Ambulance rules vary strictly by state and territory borders. There is no single national price. Notice the variables overlaying the regions. Your cost is dictated by state residency, concession status, private insurance, or ambulance subscriptions. Because these rules are localized, you must consult your specific state or territory's official ambulance authority and health department for accurate information. During high-stakes medical events, your physical location and your choice of patient status drastically alter your financial exposure. Medicare also has firm boundaries. Certain services are entirely excluded, such as prescription glasses, contact lenses, hearing aids, and elective cosmetic surgery. This matrix maps exclusions. Most dental services are completely excluded. Follow the branches for exceptions, like eligible eye tests or child dental support. For allied health and psychology, strict parameters apply. You need a valid plan, specific eligibility, and to stay within session limits. Even if you meet all those strict eligibility conditions and session limits, the provider is still legally permitted to charge a gap above the Medicare benefit. Prescription medicines operate on a separate track. The Pharmaceutical Benefit Scheme, or PBS, is designed to subsidize the cost of eligible medications, but unavoidable costs remain at the pharmacy counter. You are responsible for applicable PBS copayments, the full cost of private prescriptions, and brand price premiums. Ancillary care, mental health support, and pharmaceuticals operate with conditional rules, requiring you to plan for out-of-pocket costs beyond standard Medicare. Medicare Safety Nets act as a financial protection mechanism. They increase benefits once you hit a high threshold of eligible out-of-hospital gap costs each year. This visualization tracks the 2026 safety net thresholds: the original Medicare safety net at $594.40, the concessional extended threshold at $861.20, and the general extended at $2,699.10. Warning icons bouncing off represent excluded costs like ambulance fees and private health excesses. Private health insurance acts as a supplementary layer for private hospital care and extras like physiotherapy. But holding private health insurance does not guarantee zero out-of-pocket costs. In fact, it generally cannot be used to pay the out-of-hospital Medicare gap for standard GP visits. Safety nets and private policies are designed to cap your financial ceiling during worst-case scenarios, but neither provides a total shield against everyday medical bills. Optimizing your healthcare costs requires you to act as your own financial advocate before agreeing to non-urgent planned care. This before non-urgent care checklist lists the critical financial questions you must ask your provider up front. Do you bulk bill? What is the total provider fee? And what is my expected gap? You also need to ask the administrative questions. Do I need a referral? Is it still valid? And will private insurance pay anything toward this specific service? You must also verify your own status. Do not assume that every temporary visa holder, international student, or new migrant is automatically eligible for Medicare. Eligibility must be verified individually. Finally, a concern about medical costs should never delay life-saving treatment. For a life-threatening emergency in Australia, call 000. Australia's Medicare system offers robust public subsidies. Securing the best financial outcome relies entirely on your willingness to ask the right questions before you walk into the clinic.